11:15 on the clock. Good morning, Malaysia. Otto here, coming to you live from Angkasa Puri, Kuala Lumpur, with the interview feature of the day. Of course, this day is called Health on Traxx, where we talk about anything to do with regards to health. And in the studios right now, we have Dr. Hafizah Hfmd Ibrahim, a public health medicine specialist from the Disease Control Division of the Ministry of Health. Thank you so much for coming to the studio, Doctor.
Thank you for having me.
It's a pleasure. Now, if you want to check us out right now, we are live on Facebook as well as on TikTok. That's TRAXXfm OFFICIAL. Now, with regards to today's topic, which is about Hfmd, hand, foot, mouth disease, please go away if it's possible. If you can do that, please. And if you can't, well, we have the procedures for you, and the good doctor is here to help us out as well. So anyway, the numbers are 0322825491 or 0322824746. If you want to give us a call, ask any question with our specialist here today, or just leave a comment on the comment section on our socials right now, yeah? Now, without further ado, doctor, straight to the question. The Ministry of Health recently reported a total of more than 99,000 cases of hand, foot, and mouth disease, or Hfmd, in the country. That's a big number. Now, is Hfmd something quite unique to Malaysia or not?
Actually, no. Hfmd is definitely not unique to Malaysia. It's actually quite common across many parts of Asia. Countries like Singapore, Philippines, Thailand, and China also report increases in cases and outbreaks from time to time. The viruses that cause Hfmd, especially enterovirus 71 and Coxsackie virus, they tend to thrive in warm and humid climates, and especially in settings where children are in close contact like nurseries and kindergartens. So, while we are seeing high numbers here, Malaysia is certainly not alone in this.
Now, we see, you did mention the warm weather and all that, and we are going to experience some warm weather very, very soon. So what are the things that you can advise us? Now, the next question is, let's zoom into a little. Your child has a fever and blisters start appearing. Should parents actually panic or stay calm? Should they be concerned?
Hfmd is very, very common among children, especially those under 5. Most cases are actually mild and resolve on their own in 7 to 10 days. The child may have fever, mouth ulcers, rash, or blisters on the hands and feet. There's usually no need to panic, but parents should stay alert. Because the disease spreads so easily, even a few cases can lead to larger outbreaks, especially in kindergartens or schools where children are in close contact. So, while it's not usually dangerous, it's important to identify symptoms early, manage them at home, and prevent them spread.
So what are the symptoms?
Usually, the symptoms involve fever, mouth ulcers, having rashes or blisters on the hands and feet. Though usually, some children also show warning signs such as persistent high-grade fever.
Oh, what's that?
Yeah, sometimes they can also have persistent high-grade fever, refusal to eat, refusal to drink because of the painful oral ulcers. Mm-hmm. And also, sometimes some children will also have seizures. So when these warning signs appear, children need to be taken to the nearest healthcare facility as soon as possible.
Now, here's something many parents wonder. Can our child get Hfmd twice in the same year or even the same month?
Yes, it is possible for a child to get Hfmd more than once, even within the same year or the same month.
Wow.
That's because Hfmd is caused by several different viruses like enterovirus 71 and Coxsackie virus A16. So getting infected with one strain doesn't give full protection against the others. So unfortunately, a child who's had Hfmd before can still get it again if exposed to a different strain. That's why hygiene and prevention remain important even after a child has recovered.
Now, you did mention about strains. I'm wondering, how many strains are there out there?
There are quite a number of strains. Actually,
Wow.
For Coxsackie viruses, you can have A6, A16, and then for enteroviruses, you can have 71, and so on and so forth.
Is it just for local Malaysians, only for Malaysians, or in other countries there are similar
Actually,
pathogens?
Similar pathogens also appear in other countries as well.
Oh, okay. Now, if you have any questions for our good doctor, let us know through our what is this? Our TikTok and also Facebook. I want to say WhatsApp. But yeah, let us know in the comment section over there. Just quick hello to Najib now. He says, good morning, Otto and guest doctor. Thank you so much for liking as well as sharing the Facebook Live and also the TikTok Live as well. Alternatively, if you have a child right now who experienced these kinds of symptoms, let us know what you think and the doctor will help you out. All right. So the numbers are 03-2282-5491 or 03-2282-4746. Now, the doctor has been in line for more than 16 years already in this line with the Ministry of Health. So she is the perfect person for you to actually ask further information with regards to HFMD. So stick around. We're going to go for a little short break. And when we come back, we'll delve into HFMD much more deeper. So stick around right here on Traxx. Good morning, Malaysia. Otto here, coming to you live from Angkasa Puri, Kuala Lumpur. It's a Monday, the 19th of May. It's Health on Traxx, where we talk about everything to do with health. And specifically today, we're talking about Hfmd, hand, foot, and mouth disease. And today we have a doctor in the studios right now, Dr. Hafizah binti Ibrahim, public health medicine specialist from the Disease Control Division of the Ministry of Health. Once again, thank you so much, doctor, for coming to the studio.
You're welcome.
Now, we've already narrowed down some of the effects as well as the symptoms and, of course, how do you get it? And there are a couple of variations of the disease, and you can get it multiple times, even within a month.
Yes.
This is because of a different strain. So not even one vaccine is enough to actually fight off the many types of variants out there. So, doctor, with your permission, I would like to know, how is it that this can even happen here in Malaysia? Is it because of hygiene? Is it because of people? They don't care at all. Because you did mention more than 99,000 people have Hfmd or have contracted the disease. And it's double, was it triple, the number?
It's already triple the number as compared to last year.
Why is that?
So, in response to this, I would like to say that There are probably three big reasons why we are seeing a rise in Hfmd cases this year. The first one is because of the weather. The hot and humid weather creates a perfect environment for the viruses to thrive and spread more easily, especially in places with lots of children. Second, the celebration season. We just celebrated Hari Raya, and with more open houses and travel, there were naturally more close contacts and opportunities for the viruses to spread. And third, I suppose it has got something to do with the lapses after COVID-19 restrictions being lifted. During the pandemic, children had less exposure to common infections. Now, as we return to normal routines, their immunity isn't as strong. And hygiene habits might not be as strict as before anymore, especially in childcare settings. So this wave isn't actually surprising, but it is preventable if we all do our part.
Exactly, doing our part. Now, just to add my experience into this whole talk set over here, when I went to the loo a couple of days ago, I mean, I do almost every day, but a couple of days ago when I was working, I went to the loo and I realized a couple of dudes don't even wash their hands after they went. And I'm like, why? Why is this even happening? I don't know the people. If I knew them, I'll ask them, hey, you have kids. What will happen if your kids notice this and they continue that habit? They'll contract Hfmd, or even worse, something even more dangerous than Hfmd. So my question is to everybody out there, please, what are you doing? But anyway, I'd just like to do a quick hello for those who are online right now on Facebook. Let's see. We have Liz Hodges said, good morning, awesome DJ Otto, and very warm welcome to our lovely guest, Hafizah Ibrahim. We have Christina Chen says, hello, good morning. Let's see. Who else do we have? We have Najib now. He says, could I get it from my son then? What are the preventative measures to take? Because according to Najib, my son got Hfmd a couple of months ago, and the doctor says even adults could get it. So what is your advice on that?
Well, for Hfmd, it's actually, even though it is more common in children, adults can actually get it too. In most cases, adults will have milder symptoms, and sometimes they will have no symptoms at all, but they can still carry and spread the virus. So you may not even realize you're infected, but you could still pass it on to your child, especially through close contact, contaminated hands, or shared items. So for adults, it is very important, especially for teachers, parents, caregivers, to practice good hygiene, especially through regular hand washing, disinfecting surfaces, and also avoiding contact if you're feeling unwell.
And doctor, can this be spread through even like, for example, a pen? Because everybody uses the same pen. Can it be contracted in that manner?
It is possible because it is a contaminated surface. And bear in mind, this virus can live quite for a number of days on contaminated surfaces.
Wow. So what kind of detergent or what kind of like antiseptic or whatever protection can we do?
Actually, we all know about this because we already talked about this during our COVID-19 pandemic. So a simple use of hand sanitizers and also a simple use of alcohol and properly cleaning whatever contaminated areas and also shared items will actually help prevent the spread of Hfmd.
I have mine.
Yeah, glad you do.
I always wipe before I come.
Yes, that's a very good practice.
Yes, I don't want to contract or give out any of these diseases to anybody, so I always make sure I wipe the whole system down as well as make the whole system clean. As also your chair too, I wipe it down for you.
Oh, thank you very much.
So there we go. Please make sure that you take care of your hygiene. We're talking to Dr. Hafizah binti Ibrahim, a public health medicine specialist from Disease Control Division, Ministry of Health. She has more than 16 years of experience so far. And off topic over here, how many do you think that there are more patients now than there were before?
Meaning hospitalized?
Yes.
Actually, for Hfmd, most cases resolve spontaneously in 7 to 10 days without actually requiring any hospital admission. But very small proportion of this number will actually come down with complications such as dehydration because they are not able to eat or drink properly. So they might require hospital admission. And some might even get seizures, which will warrant also admission in the hospital for observation because we are in fear of them developing complications, especially to the brain, like meningitis. or sometimes can present also as paralysis similar to polio-like.
Wow. So, can you tell us a bit more about this when it comes to schools, right? Let's talk about schools and daycare centers. Is our child safe right now? We're hearing about some closures due to HFMD as well. What's really going on, actually?
Because Hfmd spreads very quickly in places where children play, eat, and interact closely, like schools and daycare centers, even one sick child can infect others through coughing, sneezing, playing together, sharing toys, or touching common surfaces. That's why it's so important to keep a sick child at home, not just for their own recovery, but also to protect other children. In some cases, temporary closure of schools or childcare centers may be needed to break the chain of infection and to carry out disinfection and other control measures. It's all about stopping the spread early and protecting the community, especially young kids who are more vulnerable to this infection.
Now, what are we talking about? Are we still going back to the COVID-19 days whereby before entering the daycare, they need to wash their hands first before even entering, or their feet? Or what is your suggestion towards that for daycares?
Okay, for daycare centers, usually we advise the teachers and also the caregivers to practice gatekeeping. That means prior to entry to the premises, they need to be screened for symptoms like fever and also rashes or blisters on their hands and feet. Should any children actually display these symptoms, they should be advised to visit the nearest healthcare facility as soon as possible to ascertain whether it's actually HFMD or not. And for any parents, if you one day decide to bring your children to the nearest healthcare facility, you can also obtain actually quarantine leave from your workplace for the government servants. While for all the other private sectors, you can actually discuss whether you can use your annual leave or any special leave related to any infectious diseases quarantine.
Well, I hope that answers a few questions from those who are online, specifically to Najib Nawi. Thank you so much, he said, doctor. Now, we're going to go for another short break. So if you have any questions you'd like to ask the good doctor, let us know in the comments section on TikTok or Facebook, or just give us a call at 0322825491 or 0322824746. We're going for a short break, and when we come back, we'll delve much more deeper on HFMD as well. So stick around. Otto here with you till 3 p.m. on Traxx Midday Buzz with me. Yes, and of course, in this hour, we're talking about health. Hfmd, please go away. That's the topic for today. And we have a good doctor in the studio, Dr. Hafizah binti Ibrahim, public health medicine specialist from the Disease Control Division of the Ministry of Health. Thank you so much for coming to the studio once again. And of course, to those who are online, thank you very much for staying tuned as well. Raja Hartana says, great doctor. Thank you so much for that. All compliments over here on social media. Now, doctor, off air, we were talking about HFMDs, how it spreads and all that. My next question is, can you actually contract HFMD from pets?
Okay, so don't worry, fellas. HFMD doesn't come from pets, and you can't spread HFMD to your cats or dogs. It's passed from child to child or person to person through saliva, mucus, and contaminated surfaces. So remember to keep those hands clean.
Exactly. Bring a hand sanitizer every single time, and think twice before you shake somebody's hand or grab something from, from the table or something, yeah? Because our mobile phone is one of the biggest contraction of different kinds of viruses and also different kinds of bacteria. So ensure that you keep your hands sanitized, all right? So my next question, doctor, is has every child in the country been vaccinated for HFMD?
Okay, so currently there is no Hfmd vaccine included in our Malaysian National Immunisation Program. So this means that the vaccine is not routinely provided to all children through public healthcare services. So the answer is no.
No. And the reason is because there's so many variants out there that it's difficult to for a specific one, this vaccine.
Precisely. But while inactivated enterovirus 71 or EV71 vaccines, which actually target one primary virus causing HFMD, actually it has been developed and approved in countries like China, it has not yet been approved or made widely available in Malaysia yet.
So we still have a long way to go. And of course, please remember to keep yourself clean at every single moment, especially your child. Now, doctor, when it comes to HFMD as well, what is your advice before we let you go?
Okay, so here's what I like to leave with our listeners today. First, there is no specific antiviral treatment for HFMD and there is no specific vaccine for HFMD. So prevention and early detection are key to protecting our children and also to prevent outbreaks. To reduce the risk of infection, remember to wash hands regularly with soap and water. Clean and disinfect frequently touched surfaces and shared items. Avoid sharing utensils or personal items. And keep sick children at home until they fully recovered. So for early detection, watch out for fever, mouth ulcers, rashes or blisters on the hands or feet. Parents should seek immediate medical attention at the nearest healthcare facility if the child shows persistent high-grade fever, becoming lethargic or show signs of unusual drowsiness, having poor appetite and also seizures. HFMD is usually mild, but it spreads very easily, especially among young children. So early detection, good hygiene, and keeping sick children at home are crucial to stop the spread.
Just to add to that as well, doctor, please, for those listeners of Traxx FM, spread the word as well, because these things can be contracted time and time again on an almost like monthly basis as well if you do not take care of your hygiene. So like the doctor said as well, make sure that you don't share any of your personal items to anybody else, just to a precaution, of course, and make sure to watch who you shake your hands with, because you never know where that hand has been. So yeah, please make sure that you take care of your hygiene and spread the word. All right, Malaysia? I do not like to see these numbers go up again. 99,000, my goodness, 3 times since how many years? Last year.
Last year, as compared to last year.
There we go. So what's happening right now? I have no idea. And the good doctor is already tired of, seeing all of you people doing the same thing again. So yeah, please, Traxx FM listeners, spread the word. I know you don't do this, but now it's a time for action. Okay.
All right.
Anyway,
thanks.
thank you so much, doctor, for coming to the studio. We're talking to Dr. Hafizah binti Ibrahim, a public health medicine specialist from the Disease Control Division of the Ministry of Health. So we're going to go for a short break and then we'll straight up to the news. So stick around right here on Traxx. And of course, thank you for tuning in.